saying before about bacteria getting under the gums, that's why oral hygiene at home is really important as well. Lots of people think that even brushing twice a day is enough, and it's just not. The toothbrush doesn't get in underneath the gums, it doesn't get in between the teeth, so it's important for people to be flossing as well. And as we mentioned earlier as well, having those 6 monthly cleans, because even if you've got perfect oral hygiene, you will still get a little bit of mineral buildup, and that mineral buildup contains bacteria, and when it sits on the teeth, it causes an inflammatory reaction with your body, and over time, basically, if your gums are bleeding, it means that gum and bone is breaking down. Lots of people who come in, they say, oh, I don't floss because my gums bleed when I do. And I always say to people, you know, if you're seeing bleeding, that's a little red flag from your body saying that you actually need to clean that area, not avoid it. So it's really important brushing twice a day, flossing once, and having your 6 monthly cleans.
Yeah, and flossing's so important too, because each tooth is made up of 5 surfaces essentially, and brushing only gets the front, the top, and the inside, and so you're missing 2 whole surfaces. That's if you're not flossing.
Almost half of your tooth that you're not cleaning there.
Exactly.
Actually, what I found myself is I try to make it as part of as a habit. Like, you know, otherwise I'll just forget to floss. So what I do is I just brush my teeth before I go to bed and just floss at the same time. So if I forgot at that time, I'm like, oh, there is something missing. I need to floss.
I agree. Do you know, I even floss first. Because then I want to brush. So I floss first, and then you get a nice minty fresh feeling after brushing your teeth too, so then it's definitely done. You're not going to make an excuse not to do it.
Totally. But we find that the people who do floss, they are the people that have the least dental work that needs to be done, and they just have the best outcomes. And even in terms of preventing further work to be done, it's not even just that. Also, any dental work that you do get done, like fillings, crowns, things like that, all of that will last a whole lot longer if you are flossing your teeth and keeping up with your oral hygiene. Another thing that I often hear from patients is they've said, oh, well, I've got a crown on my tooth, it therefore doesn't attract any plaque on it, I don't need to have it cleaned. But what people don't realise is that that crown is still sitting on tooth structure. Even if that tooth structure is under the gum and you can't see it, the bacteria can still attach to it. So it's really important to keep everything clean.
What about bridges? How do you guys think what do you think the best way to clean bridges are? Because I get that
either with Superfloss or Pixters, I find. Superfloss is probably the best, but most people struggle using it. If it's at the front, Superfloss is wonderful because it is a bit easier to get that in. Superfloss is like normal floss, except it's a little bit spongier, and it has a sort of stiff tip on it, so you can thread it underneath the bridge there. But for back teeth, Pixters are wonderful. And even if you're finding that you've got some bigger gaps between your teeth, sometimes Pixters are a great option, as well as using your floss there.
Yeah, that is true. And it's also important to floss implants as well.
Oh,
even though it's not tooth structure, it still will.
We'll treat them as normal teeth, you know, you just floss normally around them. Actually, if you do not floss around them, you know how you can get like normal gum disease around the teeth? You can get gum disease around the implant as well. So it's, you know,
really important.
It is.
I think the overall thing is dentistry is preventative. In terms of tooth decay, gum disease, lots of people think they're just a part of life. They're not. If you keep on top of everything, there's absolutely no reason why you shouldn't have to have extensive work. It should really just be a check, a clean, maybe a little filling or 2 here and there. But yeah, as I said before, the people with the best outcomes are those who have the best oral hygiene.
And it's like anything, maintenance. You know, you take your car every 6 months to get serviced.
Everything
clean your house every week. You know, same thing with your teeth. My favourite thing in life is food. So for me, it's so important to keep my teeth.
Speaking of that, you know, a lot of people say to me, you know, I brush my teeth, I floss my teeth all the time. Why am I still getting all these cavities? And what we're putting so what we're putting in our mouths all the time, both drinking and eating, is huge as well.
One of the biggest issues that I find when parents come in as well these days is, particularly as they're trying to keep their kids away from lollies and chocolate and things like that, they're having a lot more fruit and a lot more fruit juice as well. One of the biggest things that I tell parents is even if you squeeze that juice at home, it still has sugar and it still has acid in it, and that will break down the teeth as well. Another one for people to be aware of as well is soda water or sparkling water, or even just normal water with lemon in it as well. So I only say to people on a weekday, just plain water, and on the weekends you can treat yourself then. But really important to stick to plain water throughout the weeks for both adults and children as well.
Yeah, that's true.
Yeah. I suppose the other piece of the puzzle too that I see with patients who say, you know, who then say, you know, I brush, I floss, I don't eat any junk food, and I still have decay.
Yep.
The other piece of that puzzle I find is their own defences, which is saliva, which I know sounds weird, but saliva is our own...
It's liquid gold.
Yeah, it's our own teeth's natural defence. So some people actually do have like a disease of their saliva where the saliva is not doing its job properly, and for those people, that's why it's extra important for them to be getting in more often to have their teeth checked.
Absolutely.
Because they're at a much, much higher risk of having dental diseases. So, yeah. You think of, you know, patients that we see maybe that have either have an actual disease in their saliva glands, or they've just had some radiation treatment for cancer and things like that. I mean, when you knock out those saliva glands, the teeth, they have, oh gosh, they get so much damage just in such a short amount of time too. So it just highlights again.
When we can identify that, we can help you change your toothpaste. There's a particular product called Nutriflor, which is really, really good. So
tooth mousse is great.
Yeah,
as
tooth
well.
mousse as well.
Yeah.
And all those products really help to strengthen your saliva and help repair some of those areas that are starting to break down.
Do you guys ever get questions about why X-ray is so important?